to the next slide. So the three things that we really want to talk about is what mentees need to know about their professional development, their professional identity, um, what they are going to want to have access to as far as resources and information to learn more about as they move forward in the field. And then this idea of professional friendship and what this relationship of mentee looks like. So coming from the perspective of having been in this field for a long time, but being a faculty and now an associate dean in this field, I get to talk to students every day. I get to talk to new graduates a lot. And one of the things I'm seeing is that professional development is kind of a question mark. They hear the words, they touch upon it in some of their courses, the words, but they're not making the connection really of what is a professional identity. It's not just a hat you wear, it's kind of who you are. They're not getting that, and they're really needing a lot of our guidance as far as what does it look like to kind of grow into a professional identity in that development. Because without that, they're just performing a job. They're just coming into an office, sitting down and performing a job. They're never going to make that connection that we would really like them to make as a professional, but also they're not going to develop into this profession to be our next leaders. And as far as professional knowledge and guidance, once they're done with school, they still have their textbooks, but they have to understand that there's so much more out there. We at a university, we teach the basics. We have 60 credits, we teach the basics. And everything else that we learn out in the field. We're learning from CEUs, we're learning from each other. We're learning from going to AzCA meetings. We're learning from all these other different places. So how can they access that? And then how do we help them find like free resources or low cost resources? And then the relationships. Again, post-pandemic, I'm noticing a lot of students really struggle with what do appropriate relationships look like. And so I think we can add some guidance to that too. So those are the three topics that we'd like to cover. Next slide. Let's see. There we go. Okay, so starting with professional development and just kind of looking at how do we get established in this profession. Like I said, professionalism seems to be difficult. I was just at WASES, so that's the Western Region Association for Counseling, Education, and Supervision. It was in Tucson this year, so I went to the conference. And since University of Phoenix is an open access school and we don't have a lot of requirements to get into the school or to get into our programs, I thought, well, maybe I'm just experiencing a lot of this because these are my students. But what I heard across the board is it didn't matter. It was counseling educators and supervisors from a variety of universities across the country. Everybody is basically saying the same thing, that our newer people coming into this profession are struggling with understanding the importance of professionalism and what professionalism looks like. They have trouble understanding what does it look like to be respectful towards your colleagues. And they're very casual, which we're being casual today as well, but our casualness isn't disrespectful. And we're having to help them set those boundaries and understand, what that looks like. We usually have people who understand after going through ethics class that they need to maintain confidentiality. It doesn't seem to be huge, but it's hard for them sometimes to recognize that in their discussions about clients and cases, you still have to maintain that confidentiality. You can say a lot, but you can't, there's certain things you can't say. So helping them to understand that. Big piece, accepting feedback. If you're new in the field and you already feel a little bit defensive, like I'm not sure that I know everything, Am I supposed to be here yet? I have that whole imposter syndrome going on. Then listening to someone give you feedback, sometimes you can be too defensive and you really can't take in the fact that this is good feedback and I need to look at myself and I need to be able to apply this. And those are some of the things that I think we really want to help people learn how to do. And I'll kind of turn it over to you, Aspen. What are your thoughts?
Yeah. From a mentor perspective, like what our hope is for mentors is that they are first and foremost a model of these things. So somebody who does value collaborating with their peers and building community, somebody who is also reliable and accountable, right? Part of the mentor role is going to be coordinating with the mentee to schedule meeting once a month. And so our hope is that we have mentors who are modeling what we would want to see mentees do in their own professional world too, which is simple things like being able to schedule the time that you're meeting and being on time, but also being professional in how you're meeting with them. It's meant to be a personal relationship. It's kind of a personal professional relationship. So we want mentors to be able to model that, and who are also, from a mentee perspective, who are also sensitive to what Sheila was talking about, that these are going to be new professionals or grad students who are in a learning stage where maybe they have a lot of imposter syndrome or a lot of questions. And so we want mentors to be patient and understanding to that and be able to pour into a mentee's professional development and give them feedback and broach tough conversations, but in a way that you would like with the client, in a way that is sensitive and kind and patient.
We also want to help our mentees to learn how to collaborate and doing that openly, which means, like Aspen was saying, modeling that open collaboration. So the way that you're talking to the mentee is in a collaborative environment, and asking them for their input, of course, to show them everybody has a voice and every voice is important.
Yeah. So that's kind of the first part, is fulfilling this, supporting a mentee through their professional development. The next section of, or next portion of a mentor's role is going to be networking. So first of all, this is building a relationship with somebody that already is networking, but also being a guide and a model for what networking can look like, and just the importance of networking in the field, especially for somebody who's new. So Sheila, I'll let you start off with the slide and then I'll tack on to that.
So networking is another one of those areas where we're finding that it's difficult to know how to network. Most of our newbies in the profession, they are used to being online. They're used to being on text. They are used to doing things virtually, and they're not sure how to broach these relationships. And a lot of times those relationships are better when you can go in one-on-one, or that you can break into a room like this one, even if it is virtual, and that you can get some name recognition, that you can start to understand who are the big names in your community. Who do you need to get to know? Why is it important to get to know these people? So this is part of, what we're hoping is that you can help people, maybe take them by the hand, get them involved in something in the professional realm where they are meeting other people who are professionals. One of the things that we have to help them to do is kind of hone in that little bit of an elevator speech, so that when somebody comes up and says, "Oh, well, it's nice to meet you. What do you do?" that they can respond succinctly, but also with impact. I work with eating disorders and with issues of sexuality and sexual abuse or whatever. I work with children ages 6 through 12 who have had trauma in their life, whatever it might be. We want them to be able to have this kind of elevator speech so that they can identify themselves and where they fit. We also want your interactions with them to be very sincere and authentic, so that you're not just trying to market them, but that you see them as this professional and that they can feel that. So I know that's kind of hard to describe, but when I think about, my relationship, with Aspen or with Craig, as a mentor, I think about just the relationship that we have. And um, it's very authentic. It's very sincere that I understand what they do. I understand who they are and I understand where they want to be. And it's always my aim just to help guide and find resources and find ways that to make that a little bit easier. So I see that as being important. I also see being important is sharing with them your experiences of how does LinkedIn work? How do emails work? What are some bylines that you should have on your emails? Like how do you put out information for other people using email that's effective? How does social media work and how does it work against you? And any stories that you have that you could share about how someone either benefited or the opposite, where social media came back to bite them in the butt, is going to be really, really helpful since it's hard for our students and our new grads to recognize that what they have posted on social media can work two ways and and it stays with you a really long time. What are your thoughts, Aspen?
What I think of when I think of professional networking is partially what you were talking about, Sheila, is like helping a mentee identify ways that they can network and continue to build their professional relationships, and kind of like what Sheila was describing, in a way that helps them reach their goals. So part of the mentor role is working with the mentee to identify what their professional goals are, and then relying on your own network, your own networking skills, and pouring that into them so that they can continue to meet new people in the field, build more relationships, and work toward those goals. What I think of when I think of an introduction or an elevator speech, I think of professional brand. So this is not only their elevator speech of like who they are, but really how do they want, kind of exploring like who do you want to be known as in the counseling field? What kind of legacy or mark do you want to leave? And just letting that be an explorational process and conversation with a mentee throughout the year. As somebody who is recently became an LAC, I'm very much in this process right now. I work in private practice, and so I'm constantly thinking of how I want to niche myself or market myself and who I want to meet and who I can learn from and who I want to teach what I have learned. And so my hope for mentees is that this could be a continual conversation and exploration in what kind of and what a mentee wants to leave in the counseling field, especially for grad students. They might really have no idea. And so this might be starting really small, which is what are the kind of diagnoses you might be interested in? What are some populations that you know that you want to work with? Or what are some things that really are uncomfortable for you? And maybe that's a conversation you guys can have. Like, what about that makes you uncomfortable? Is that something that we should be trying to challenge you to get outside of your comfort zone? Or is it just really helpful to know that like this is not something you want to be part of your professional brand? So like I said, I hope that that's an explorational process and collaborative conversation throughout the mentorship program, helping somebody figure out how they want to brand themselves and then network according to that.
Nick or Laura, do you have any thoughts or any questions so far?
I think what's coming to mind for me is just how much this is a part of my day-to-day experience, and I'm just seeing some additional benefits, not only helping incoming therapists learn how to do this, but also I learn a lot from teaching. So I think this is a relationship that can go both ways as well.
Oh, definitely. We learn a lot from our mentees.
Laura, anything?
I apologize. I don't really have any questions, but so much of this is really resonant. I actually teach professional orientation to mental health in the master's program. So this is really, I'm really yeah, just really echoing a lot of things you're saying, Sheila. Like, I'm like, yes, yes, yes. There's a lot of barriers to professionalism with the emergence of social media, which when I was in my graduate program wasn't, as large of a construct. So I'm seeing students struggle with that. So this is,
Absolutely.
yeah, beautifully presented and really on board with your message here. So
Perfect. Then we'll just keep on going.
Perfect. All right.
The idea of name recognition, I don't know if your experience with mentees or students or new people in the field has been like mine, but they don't understand that name recognition is something that we become familiar with people and their names, just like they became familiar with ours. And that in order to do that, they have to be saying yes to things. They have to be able to put their names on things. And you can't put your name on something that's not yours. So you have to say yes to opportunities, and you have to say yes to doing something. You have to say yes to being someplace. And I always say, look for the chance to say yes, because as soon as you do that, your name gets to go with this. And then people start to recognize who you are and what you do. That also opens up the opportunities for different positions. Even if you're not looking for something right now, you never know for the future. In the past 13 years, I don't think I've had to apply for any job. All jobs have come to me because people have known who I am and have knocked on my door and asked me if I'm interested. That's the type of message that we want to share with our mentees, is that this is how we develop that for the future.
Yeah. I want to go back to what you were talking about in the previous slide, or previous slides, which is that, I want mentors to show up authentically and really speak to their passions in the field, because my hope would be for mentees to do that too. And when you're new in the field or a student, that can feel really scary and vulnerable. Like with the imposter syndrome, going into the field saying, oh, I don't know if I want to be loud about the things that I really believe in or I'm really passionate about. And so I think that speaks to the name recognition, though, is that if we're encouraging mentees to be bold and say yes and take risks and do things that make them, that intimidate them and get them outside of their comfort zone, that's awesome. I would want the same thing for my clients too. So I think this can be, an opportunity to encourage confidence within that relationship.
Well, and that ends at last point: support system for advice, consultation, supervision, or encouragement. There's nothing more beneficial to any of us in our lives than to have that person that we know we can trust to reach out to and say, I need a little advice, or I had this situation or this client or this event that just happened, and I really want to consult about it. I want to talk to somebody about this. And to have someone who genuinely cares, understands, and can listen. And that's your role. Whether you give great advice or whether you are a person who helps them hone in on what they already know is right, that doesn't matter as much as being there for them, being authentic, being genuine, being yourself.
The final thing I'll add is that this mentor relationship is not a supervisory relationship. And so part of this is like the acknowledgement that, at least for me, my whole friend group pretty much works in mental health care. So a lot of our casual friend conversations also bleed into consultation. And let me ask you a question. Let me get you your idea. And so it's not a supervision relationship, but you all can help them figure out what their work-life boundaries are going to look like. What conversations about their work do you want to have, or do you want to create boundaries around that? And when can I turn toward a mentor or a friend to ask a question or get an idea, compared to when I need to go to a supervisor? That will be part of your role, is clarifying that, maintaining boundaries, and helping a new clinician understand what is specifically set for supervision, and then what else is just like the fact that this is a collaborative field and we're constantly leaning on our supports and asking questions and getting ideas. Does that make sense? Okay, awesome. Go to the next slide. So defining your niche is something that, I spoke to this a little bit with professional brand. And so I don't know that we need to dive into this too much, but did you guys have any questions about what I was sharing about helping them kind of figure out what their niche might be or figure out their professional brand?
No, pretty clear.
Okay. Especially working in private practice, I think this is something that's really is a constant focus. But if you have worked in community mental health, or if you're working with a mentee who works in community mental health, there may have been less of an emphasis on this. Some people are put in, as you all know or probably have experienced, you might be put in a position where there's no room to niche down. You're doing everything. So, encourage these conversations. Some people might be much farther along with this than others, but, for people in those situations, they may not have thought about this at all because their brand is tied to the organization that they're working with and whatever they are telling them to do or tackle. So your mentee may be could be in many different places with this one, but I'll go to the next slide. I think we covered that already.
Okay, finding resources, information, and knowledge. So once you leave school, you're on your own to find these things. Organizations like PESI or even CEUs for less, you can access things online, but they're all costly as well. Newbies in the profession, well, even us as oldsters in the profession don't necessarily have money to throw as CEU credits all the time. However, it's nice when we can find those resources. And one of the ways that we can help our mentees is making sure that they understand what the credible sources are. And what if there's something out there that is more of an opinion or more of something that people are just putting online, that you want to check things out well. You want to know, who do I go to? Where do I find the real information? What are the credible sources? And then how do I find this information so that it's usable for myself and maybe my clients? One other thing I want to bring up is the digestible chunks. Everybody's excited when they get started in a profession and they want to do everything and learn everything, and they want to learn it right now. They want to learn how to be this kind of clinician. They want to get certified in this and this. They want it all, because you want to feel, really confident in what you're doing, and you want to have all the tools right away. And we have to help to put those boundaries up and say, slow down, and get them focused so that they can do digestion. I'm watching Laura smile here. You experience that, don't you, Laura, with your students?
I experienced it for myself.
Okay.
So like I would have needed to hear that. It's such a good point. Yeah.
Yeah. So, just helping them to say, okay, let's slow down. Let's take a look at this, and to prioritize. What's the most important thing that you really want to gain right now? That's going to be the most helpful, and you're the most interested in, and to help them, access those resources then, and take in those continuing education opportunities that are out there.
Part of the start of this mentor relationship will be working with the mentee to define what their goals are for the year with you within the relationship. And so that'll help you all kind of figure out how to navigate what resources might be helpful, how you want to map that out over a year and set realistic timeframes and goals around that. I personally cannot relate to wanting to know everything early on. That would never happen to me. But I can also say, even from a mentor perspective, that I think, like, from a mentor perspective, it's also really exciting. Like, I'm excited as a new clinician in the field, but because I have helped shape this program, I've gone back and forth about whether to be a mentee or a mentor. And so when I think about serving as a mentor, I am so excited. Like, oh, I want to tell you everything. I love this career. And so it also is for the mentor role to maybe like rein themselves in and be able to set realistic timeframes for the mentee who's really excited and also has imposter syndrome and feels really uncomfortable not knowing all the things, but also from an excited mentor stance too of setting realistic time frame and being understanding of the fact that some of what we share might be overwhelming or really early. The only other thing that I wanted to add to this is that as a mentor, we want to protect you from liability too. And so part of this is you might have a mentee who wants to take on, depending on what your experience has been, you might have a mentee who wants to take on a supervised private practice or something like that. And so part of this is not only pouring knowledge into them, but really helping guide them to find information themselves, because some of what we share, ethics, laws, board expectations, change over time. So this is not just going based off of your own experience, which is still super useful, but where they can find up-to-date information that could change over time so that they know that they always can access accurate information.
Oh, that's a really good point. And I was thinking about the newsletters, the groups, and the different platforms that are out there, even the different management software systems. There's so much information because things do change all the time. And helping people recognize what's good information and what isn't, what is valid, what is being sold. Excuse me. When are they being sold versus, when are they being given information that they should look more deeply into? And especially if they are going to be setting up a private practice, who can they talk to? Who has good information? Who is, again, going to be accurate with that information? So accuracy is such a big, important piece of this.
Yeah. Okay, so this is the third portion or third responsibility of a mentor is the professional friendship. So we're going to just talk a little bit about, we've been speaking to this, but talk a little bit about what this position is meant to be and what it is not meant to be. So as we've been describing, we're in a field of relationship building. So we want this to be a space where mentees and mentors can be authentic, can be open, who will show up personally and professionally. So maintaining professional boundaries, but understanding that you have a mentee who will be really excited to meet with you and who might look up to you as like a personal mentor and a friend in some ways. I already spoke to this earlier, but it's not a supervisory relationship. So we will lean on the mentors to set boundaries and expectations around that when they feel like maybe a mentee is looking for clinical supervision or wants to talk specifically about a client. Your responsibility will be to turn them back to the supervisor. And that might look like, maybe addressing like their fears around going to a supervisor or something like that. That's an emotional support, but turning them to the correct resource for that. But otherwise, one other thing we want to mention is that this is a year-long meeting with somebody, and you can choose to meet with them for more than 1 hour a month if you want to. And so this could turn into some other kind of relationship. You are working with students who are going to be graduating and looking for a job. You might be working with an LAC who wants to move practices. So we are going to lean on you all to lean on your professionalism, the ethics and laws that we're all held to manage the boundaries if a dual relationship is created out of the mentor program.
I want to also add to this that Brene Brown says something that really always sticks with me. Clear is kind. So be clear with your mentees. Laura's laughing.
Yeah.
With your mentees, because that is the best thing that you can do when you're communicating with them. Let them know exactly what that communication is going to look like. What are your meetings going to look like? What is the role as you see it? And then finding out what role do they want and how are you going to create that together so that you can have that clarity, so that you can be doing the kindest thing for this person who's going to be looking to you for some guidance. And, keeping it too blurry is not kind at all.
So we want to, that's all of our slides. So I want to turn it to you all and see if you have any questions. We defined what the mentorship relationship is going to be defined as, with professional development and branding, building in networking skills, and the relationship in part is networking and forming a professional friendship and maintaining appropriate boundaries around that. But do you all have any questions about anything we covered today or the program?
Yeah, I've got a question. In terms of, I love the idea of the relationship as being a professional friendship. I feel like I think both elements are important, especially, as we're trying to cultivate and support other people in this field that can be pretty emotionally taxing at times. Considering the considering the fact that there are some potentials for like blurred lines when it comes to the difference between mentorship and supervision, or friendship and mentorship. Are there any resources that that we're going to have in terms of like, hey, I'm encountering this with my mentee, like just want some guidance or suggestions on how to navigate it? Is there going to be that kind of a support system in place?
Yeah, that's a really great question. So there is a mentorship agreement that everybody will sign. So they're signing to understand the boundaries of the relationship. But as the program coordinator, certainly that will be part of my role, is that you can reach out to me. We have a team that has been working on creating this mentorship program. And so if there was any kind of issue, then that's something we would work collaboratively to address with you or with the mentee.
And I think the other thing to consider, Nick, is AzCA has a very good relationship also with the board, and we're always able to give anybody at the board a call and say, hey, this has come up. How do you want us to handle something? What's the guidance that we can get from, the actual board of behavioral health on this? And I know I've used them before and have a great relationship with the executive director and have talked to her about this program. And they're open to answering questions at any time for us.
Okay, great. Yeah, and that was also something I was going to ask about, is if the board had any perspective in terms of like the nature of this relationship, if they've defined it at all, or if there's any considerations that they've had when y'all have talked to them.
When I had a discussion with Toby about what we're doing, she did say, making sure that the boundaries are set, that you're not the supervisor. You are not evaluating them. You're not the supervisor, but that you are in this role of mentor, in this role of being able to give guidance. She actually said, when you say the word advice, be careful. Keep it more as guidance rather than advice, because advice can be misinterpreted as I was told to do something versus I'm being given some guidance that I can consider and make my own decisions.
Yeah. That's where I would lean on to, is our own skills that we would use with clients. Is that if somebody is bringing to us a question or concern, I mentioned earlier, we want to refer them to resources like the board or things where they can get concrete information, where it's protecting your own, protecting you from liability, but also in the way that we would help a client, reflecting back to them what feels right to them, leaning on their own judgment, intuition, their own goals, so that we're, in the same way that we would want it to be about the client, it would be similar with the mentee, that we want to really guide them based off of what they need and what they think and want.
Okay, got it. No, I appreciate the clarification.
Yeah, really great questions.
Going off of that advice piece, I find using invitational language to be extremely helpful. So rather than I advise that you do this, or I recommend that you do this, I want to invite you to consider that, or I want to invite you to explore these resources, rather than kind of telling someone what to do, whether it be client or someone that we are mentoring, because we want to foster that sense of self-leadership. And we can't do that if we're fostering a codependency or a dependency on us as the mentor.
It's a good point, Craig. And we're going to need to watch as mentors that the mentee isn't looking to try to create a codependent relationship where they want to come to you for all of their needs and all of their advice. Because that, if they don't have a large support system, if they don't have people in their life that they feel they can trust, they may lean too heavily on you, and you're going to have to recognize when that's happening, just like you would with a client.
One other part of this, when you all are meeting with your first, when you start to coordinate, what this will look like is that in January, we'll let you know who you're paired with. You will have the responsibility of connecting with them. They may reach out to you first, but coordinating that first meeting where you're going to talk about these three responsibilities that you have as a mentor that we went over today, but also what the boundaries are going to look like for the relationship. So how this is laid out is meant to be that you meet for 1 hour a month over a 12-month period. That's the minimum expectation. You can choose to meet with them more often, but it's also boundaries around communication, how you want to be contacted, what hours you're available. And this is where I lean it back to a client. It's the same way that we might set up expectations with the client. And so you get to determine your own comfort level with this. It's not a client relationship, so it is a little bit different. But if you feel most comfortable having contact that is over email or that is only within business hours, you can establish those boundaries with your mentee at the beginning of the program. I really like what Sheila said earlier, that clear is kind. And so leading with those boundaries up front and just being really clear about what this relationship looks like will be helpful. But throughout the year, you'll have access to me, Craig, Sheila, the board. Toby Zavala is the executive director of the board that Sheila was talking about earlier, to check in, and we'll be checking in with you too in case there are any issues that need to be resolved. Laura, did you have any questions? Oh, go ahead, Craig.
I was going to say one thing that kind of came to me through listening is just the interconnectedness of all of these different kind of main points in our role as a mentor. So, maintaining those boundaries, serving as that bridge to that network. Maybe I'm connecting my mentee back to their supervisor, or have this colleague who actually has more skills and experience in social media. So let me connect you to this person who can maybe give you a better perspective than I would be able to. And really kind of how all of those pieces can connect. Maybe I help my mentee. Here's how you can ask my colleague Kimar about setting up a private practice. Let's talk through how you might have that meeting with her, and then I'll send that email to connect the two of you, and you can take it from there. It was really cool just to kind of see how all of those parts seem to come together.
Thanks for saying that. Any other thoughts or questions? Okay, so next steps from here, if you haven't done so already, I know some of you have already filled out an application, but if you haven't done so already, you can complete the mentorship application. There's a link here. I can also email it to you if you email us at the email on this slide. And from there, you will also send your resume to that email address. We will have you complete the mentorship agreement. We'll end up sending you that after we review your application and all that good stuff. So that's not an immediate part, but when you open up the application, you will see that that's a step that we go over at the end of the form. So that's next steps. The only other requirement, as you all already know, is that you have to be a member of AzCA. So it'll ask you to confirm that. We are nearing the end of the year. So some of us might be in the renewal period where we have to renew for the next year. So just be mindful of that. But beyond that, I am available for contact at that email. My name is Aspen Turney, like I said earlier, so you can always find me through, I'm highly Googleable, I like to say. So if you reach out to me on my personal contact, that's also totally fine. But I really appreciate you guys meeting with us today. And if you have follow-up questions, definitely reach out. Sheila, is there anything else that you want to add?
You can also reach out. I'm also highly Googleable, I believe, but you can reach out to info@AzCA as well. They will direct your question to one of us. I'm also available, sheila.babender@phoenix.edu. It comes to my phone. I can see it. I'll answer you. So any thoughts, any questions, anything that comes up after you're done with this call and you're like, oh, I should have asked that, feel free to reach out. We're here. And we are kind of co-collaborating as we are building this and hoping that it is something that's going to be beneficial to our community.
Thanks for meeting with us, guys.